नमस्कार दोस्तों, वेलकम टू विज्ञान विद डॉक्टर जी। आई एम डॉक्टर गोविंदराजन, रेडियोलॉजिस्ट यानी कि आपका स्कैनिंग डॉक्टर। इन माय प्रीवियस वीडियोस आई स्पोक अबाउट ultrasound scanning in pregnancy, high risk pregnancy in the first trimester and the second trimester. I touched upon uterine arterial Doppler, which is a very important factor for evaluation of the pregnant patients, particularly in the high risk pregnancy. I received a couple of questions on uterine artery and Doppler, so I thought I would dedicate this particular video to uterine arterial Doppler itself. Uterine arterial Doppler is a very important scan. Uterine artery means it is the blood vessel which supplies blood to the mother's uterus. Artery ಅಂದರೆ ಹಾರ್ಟ್ ಇಂದ ರಕ್ತವನ್ನು ಬೇರೆ ಬೇರೆ ಆರ್ಗನ್ಗಳಿಗೆ ತೆಗೆದುಕೊಂಡು ಹೋಗುವಂತಹ ರಕ್ತನಾಳ. ಸೊ ಯುಟರೈನ್ ಆರ್ಟರಿ ಮೀನ್ಸ್ ದ ಆರ್ಟರಿ ವಿಚ್ ಸಪ್ಲೈಸ್ ಬ್ಲಡ್ to the uterus. Now, what is the Doppler evaluation? Uterine arterial Doppler, what does it mean? Doppler is nothing but understanding the flow parameters. Blood ಯಾವ ಥರ ಹರಿತಾ ಇದೆ. Is there any resistance to blood flow into the uterus through the arteries? Resistance, normally resistance ಇರುತ್ತೆ, ಆದರೆ ಅಬ್ನಾರ್ಮಲಿ ಹೈ ರೆಸಿಸ್ಟೆನ್ಸ್ ಇದೆಯಾ ಅದನ್ನು ಕಂಡುಹಿಡಿಬೇಕು. ಸೊ ಯೂಟ್ರೈನ್ ಆರ್ಟರಿ ಡಾಪ್ಲರ್ ಯಾವಾಗ ಮಾಡ್ತೀವಿ? We start uterine artery Doppler even before pregnancy. Before conception, we'll do uterine arterial Doppler. That is mainly to see if the uterine arterial parameters are within normal limits for implantation. That means pregnancy ಆಗೋದಕ್ಕೆ ಅದು ಸರಿಯಾಗಿದೆಯಾ. ಅಂದರೆ ಹೊಲ ಗದ್ದೆಗಳಲ್ಲಿ ನಾಟಿ ಹಾಕೋದಕ್ಕಿಂತ ಮುಂಚೆ ಬ್ಲಡ್ ಫ್ಲೋ ಅಂದರೆ ಅದಕ್ಕೆ ವಾಟರ್ ಸಪ್ಲೈ ಕರೆಕ್ಟಾಗಿದೆಯಾ ಅಂತ ಚೆಕ್ ಮಾಡೋದು. ಆಲ್ಮೋಸ್ಟ್ ಸಿಮಿಲರ್ ಟು ದ್ಯಾಟ್, ಇವನ್ ದೋ ಇಟ್ ಲುಕ್ಸ್ ವೆರಿ ಸಿಂಪಲ್. ಅದನ್ನು ಚೆಕ್ ಮಾಡೋದಕ್ಕೆ ನಾವು ವಿಲ್ ಬಿ ಡೂಯಿಂಗ್ ಅ ಸ್ಕ್ಯಾನ್ ಬಿಫೋರ್ ಪ್ರೆಗ್ನೆನ್ಸಿ, ಯೂಶಲಿ ಡ್ಯೂರಿಂಗ್ ದಿ 10th or 12th day of the menstrual cycle. So once that is showing good flow, that means low resistance, we encourage pregnancy. Once the pregnancy is confirmed, generally we do uterine artery Doppler only in the late first trimester. That means generally at around 12 to 13 weeks of pregnancy. ಆದರೂ ಆಫ್ ಲೇಟ್ we are getting many more literature evidence. ಈ ಮುಂಚೆನೇ ಮಾಡಿದ್ರೆ ಇಟ್ ಕ್ಯಾನ್ ಪ್ರೆಡಿಕ್ಟ್ ಮೆನಿ ಮೋರ್ ಥಿಂಗ್ಸ್ ಇವನ್ ಅರ್ಲಿಯರ್. ಆ ಥರ we are getting information. So we can perform uterine arterial Doppler even at around 7 to 8 weeks of pregnancy. Yeah, before pregnancy we do uterine arterial Doppler using a transvaginal probe. You can see this is a transvaginal probe. We will put a cover and insert it into the vagina and do the scan. Because that gives a very good resolution of the arteries and we can place exactly where we want to. In the 7th or 8th weeks of pregnancy we can perform transabdominally. This is the transabdominal scan probe. Okay, we can use this. This has got a relatively high frequency so that penetration is better. So we can see it better. 12 to 13 weeks again we'll do transabdominal scan. This is the time it is very important that we identify PI, that is the pulsatility index, that is the resistance in the right and left uterine arteries, and take the average of that. So that is called a mean uterine artery PI. If that is very high or abnormally high, we will have nomograms for all these values to particular gestational age. If it is beyond 95th centile, we know that it is a high uterine artery PI. We say it is screen positive for uterine artery Doppler. So what does it mean, screen positive? That means uterine artery Doppler at 12 to 13 weeks is a screening tool, and we do screening to predict if there is a higher risk of the mother developing hypertension ಅಂದರೆ preeclampsia ಆಗುವಂತಹ ಸಾಧ್ಯತೆ ಇದೆಯಾ, ಮಗುವಿನ ಬೆಳವಣಿಗೆಗೆ ಅಪಾಯಕಾರಿ ಪರಿಣಾಮ ಉಂಟಾಗುವ ಸಾಧ್ಯತೆ ಇದೆಯಾ, ಅಂದರೆ ಫೀಟಲ್ ಗ್ರೋತ್ ರಿಸ್ಟ್ರಿಕ್ಷನ್ ಆಗುವ ಸಾಧ್ಯತೆ ಇದೆಯಾ, ಇದನ್ನೆಲ್ಲ ಕಂಡುಹಿಡ್ಕೋಬಹುದು ನಾವು. ಅಡಿಷನಲಿ we can also identify if there are some reasons or causes for raised resistance in the uterine artery. Like for example, most commonly infection, diabetes, and some of the immunological disorders. All these can cause rise in uterine arterial pressure for blood supply to the uterus. These can actually affect the growth of the baby, mother's health later on in the pregnancy. So we can actually start treatment for all these conditions, and we can actually assess in the next scans whether the uterine artery Doppler has come back to normal or not. For example, if there is an infection, I can give antibiotics, follow it up after 2 weeks. If the uterine artery Doppler has come back to normal, I know that the reason was infection, I have controlled it. Similarly, I can give some disease modulators. In case of immunological disorders, I can definitely find out that the uterine artery Doppler has become normal. So uterine artery Doppler can be performed after 12 to 13 weeks. Then whenever we are doing the scans during the next 12 to 13, 20 to 14 weeks, that means up to 24, 26 weeks of pregnancy, we will be able to perform uterine artery Doppler. And it's not just about performing it, it has to be performed accurately. In experienced hands, uterine artery Doppler screening has got a wonderful sensitivity and wonderful accuracy for predicting preeclampsia and intrauterine fetal growth restriction. So you have to get a scan done. If you want to get a scan done, uterine artery Doppler scan done, you will have to get it done by an experienced radiologist who has performed it n number of times. So uterine artery Doppler is a wonderful tool, very important tool, relatively easy, but has to be done by a right person. Dosto, I have completed uterine artery Doppler today. So let me talk to you about further investigations using ultrasound later on in pregnancy, in high-risk pregnancies, in my next videos. If you want to know more about ultrasound in high-risk pregnancy, please follow me on Vigyan with Dr. G. Jai Hind.